Hey everyone, welcome to Cooperant Learning podcast. We've been doing a series. This has been a dive into ABA and adult services and adult populations. So some of the unique challenges that BCBAs encounter while working with places like adult foster care homes and group homes. We've been inviting SMEs, so some subject matter experts, to provide insight, information, provide their expertise in some of these different areas that are pertinent to working with adult populations. We have a live audience from our Sparks Behavioral Services team. And if you're listening to us on YouTube or to our podcast and you're interested in learning more about adult services and ABA, don't forget to like and subscribe to our channel. My kids said that if I want to be a YouTuber, I have to prompt people to subscribe to our channel, and I have not been doing that. So that was the gentle prompt. But our guest today is Liz Elias. She's from the Empowered Behavior Collective in West Michigan, and she's here to talk to us all about supervision and supervised fieldwork and behavior analytic practice. So Liz, welcome to our show.
Hi, thank you so much for having me. I'm really excited.
We are excited too, and if you want to take a minute and just introduce yourself to everybody, who it is you are and what you do.
Yeah, so like you said, my name is Liz. I am a BCBA. I've been a BCBA since 2017, and I've been in the field since 2013. I've spent a lot of my professional career supporting large organizations in their fieldwork programs. So making sure that students who receive fieldwork supervision in Michigan are getting the same experience as people receiving fieldwork supervision in Georgia or whichever state they're at. So I've spent a lot of time doing that, and I've recently transitioned to my own business where I provide act-based services, one-on-one to teens and adults, and I also contract with my local county to provide behavior support to adults in residential group homes or adult foster care.
Awesome. That's a wealth of experience. I'm very excited to have you here. So I'll just get right into it. I had supervision before I was certified. Some of it was great. Some of it I have some feedback for. Didn't go as well as what I wanted it to. I imagine, though, in your role, you've seen a lot of the good, the bad, and the ugly. What is it? I guess a good first question for you might be, where are we kind of as a field at the moment? What's going on with supervision? I've seen a lot of the literature kind of honing in on what like good supervisory practice is, both for RBTs and behavior technicians, but also in supervised field work, and kind of recommendations and best practice and things like that. What are you seeing out there when you're consulting, and kind of what's going on out there?
Yeah, I think we're at the space in fieldwork supervision where the academic side of our field and the regulation side of our field is noticing the big deficits out there in fieldwork supervision, and they're starting to provide us with more guidance and how to better support our fieldwork students. But the reality in the field, it is very unregulated still. There are people who come out with amazing experiences and are able to get hands-on case management experience before they graduate and transition. And then there's people out there who are completing 800 or 1,000 supervised hours and have supervisors forgetting or refusing to sign off on forms and having to do all of those over again. So I feel like we're in a really exciting time for supervision because it's really time to like bridge that gap, not only for our students who are going to carry our field forward and be the future of our field, but also for the clients that we serve, because at the end of the day, poor supervision ultimately trickles down to the clients across the board, and that's really who suffers with poor supervision.
Yeah. And you mentioned that there are deficits out there. Is this an issue of there just being an overwhelming amount of people getting supervision? Is it an issue of there being a lack of resources, or maybe a lack of looking for resources at this point?
I think there's a few things going on here. I think the first one is that supervision is not as valued in our field anymore. I think that with the shift and the change that has come in service providers, I think that the focus is on making sure we can serve as many clients as possible and sometimes sacrificing quality when it comes to that. And while it does help us reach a wider audience, we're getting diluted service practice, which in turn also kind of brings us to in a negative viewpoint to the public who don't really know how effective the science can be because they're met with a bunch of new BCBAs who had an average fieldwork experience and who are out there as fully certified clinicians trying to figure it out on their own. I think that's played a huge part in it. Focusing on supervision is a long game for organizations and for companies. So when we don't focus on supervision, we don't really see those effects until it's too late to support that, and we have to go back and start over.
What are some of the, maybe like in both directions, signs that a supervisory experience or supervised field work is going really well? And then some signs that maybe, I mean, like you said, like, you know, obviously not signing forms, that's a big red flag. But what are some of the kind of like red flags that you've seen, but also some of like the indicators that this is actually a really good relationship and it's going to create a BCBA in the future who's, you know, utilizing best practice, who's ethical, who's knowledgeable in the field and has a good start?
Yeah, I think, and I want to preface this with, I focus a lot on the responsibility of the supervisor when it comes to supervision, but I do think the environment that that supervisor is operating in plays a huge role. We as supervisors can only do so much if we're given the choice between meeting workplace requirements in order to keep our job or taking some unpaid time or using that time that we're not prioritizing for our students. Something's going to fall, and it's always going to be the thing that does not require you to keep your job. So I think a lot of supervisors and BCBAs that work for big companies that are being required to bill 30, 35 hours per week just don't have the time to be an effective supervisor. I think there's a lot of really good resources out there, but I also think that they occur in a vacuum. Everyone has their idea on how supervision should go and their idea of what's best practice and different tools to use. You can find the same copy of like a checklist, a program checklist or something like that in like 4 or 5 different supervision curriculums. And I know because I've purchased a lot of them. So I think that we have also gotten away as a field from this like collaborative space and seeing each other as a community to support and make better as a whole. And we're all just kind of relying individually to get through this. And I think that the individuality of the field on top of the stringent requirements on supervisors, again, just really has this trickle down effect to supervision again, and then trickles down to our clients and really the future of our field.
Yeah, Steve, go ahead.
Do you think that the supervision training, the 8-hour supervisor training, is enough to help people have an idea of what really should be gone over and taught in training? And what I'm really thinking of in terms of, you have someone who maybe didn't have the best training or supervision experience themselves. They may not have any other experience. Now they're expected to be a supervisor as well. Does this perpetuate the issue, or do you think some of those trainings are enough to help teach someone what they need to know to be an effective supervisor?
I think that the 8-hour training is a great start, but I feel like in no way does that make someone competent to supervise effectively. Just like we do in our field, our BCBA exam is the basic level of competence, and we learn more and more the more we practice and the more we get guidance and support from supervisors and mentors. And I think it's really the same. I think that a lot of people see supervision as just another box to check, and I'm checking all of the very gray boxes that the BACB provides us. So I'm a good supervisor, when in reality, that supervisory relationship often ends at certification, and we don't really see the long-term effects of our supervision. I think one of my favorite things that the BACB has done, and I think this is an unpopular opinion, was making mandatory supervision requirements for new BCBAs for fieldwork supervisors. Has been one of my most favorite changes that the BACB has made, because supervision's hard. It's easy to be able to, easy quote unquote, to be able to do these acts yourself, but then when you have to teach someone with no knowledge or no experience on how to do it, it's a totally different ballgame.
So who do you think's responsibility would be then in those things? Would it be like the organization, the company should be making sure that someone is ready and has experience to be a supervisor? It seems almost impossible for the BACB to be the ones overseeing that. And we know in our line of work, a lot of people don't even realize when they're working outside of a competency area. So it almost seems ineffective to expect people to police themselves in this area, you know?
Yeah, and I also think that like Liz opened the door for another controversial opinion for me. I don't think every BCBA is made to be a fieldwork supervisor. It is a totally new skill in and of itself, and that can be a little bit controversial. I'm not saying that every BCBA can't contribute to the learning and growth of an RBT or of a fieldwork student, but there's a lot of work that goes into fieldwork, and there's a lot of work and honestly responsibility into molding and shaping new clinicians that are going to go out into the world and provide services on their own the day that they're done, or the day that they pass their exam. I'm a big proponent of organizations taking on some responsibility for this. I've worked for 2 large organizations that have their own fieldwork departments where we use those guidelines and had some oversight over fieldwork supervision. And I've gotten a lot of feedback from those programs. Some people don't like the oversight because they don't like being overseen by a supervisor because they are certified and they've taken the 8-hour training, which makes them qualified to provide fieldwork supervision. But the most positive feedback I get from those programs are from the students. They like the opportunity to access multiple supervisors. They like the opportunity to see different supervision styles. And they really like the opportunity to, work through an audit with someone who's familiar with the audit process. They like the opportunity to go to a supervisor when they're having a difficult conversation or having a hard time providing feedback to their fieldwork supervisor, because it provides that middle median ground. So I do think organizations should bear some of the responsibility. And if the organizations that are out there providing these services, to me, that shows that they value the future of their company and really the future of the services that they're providing, because it's really common to provide fieldwork supervision in hopes to hire that person. And if we are doing that, I think we should be really focusing on these training programs from an organizational level too.
Yeah, I like that. I was going to mention too, a lot of times I see, anecdotally, like on the Facebook pages and things like that, but then also in the literature, citing sources of burnout, and burnout being one, high caseloads with a lot of hours, but 2, lack of support from supervisors being a big source of burnout. And it's almost like we're shooting ourselves in the foot by trying to pump through so many hours and have such high demands on our clinicians, but then also task them. In addition to that, make sure you're helping somebody else get to where you're at too. It just seems like burnout's inevitable from that standpoint.
Yeah, it's like, I know you're stressed out managing all of this stuff at work, but also here are these 2 students that we're counting on you to mentor and provide supervision for, because we would like to hire them when they graduate. Like, that is a lot of pressure. And if you're not someone who enjoys teaching or who enjoys modeling and taking the extra time to work through things, then that, I feel like, is really a recipe for disaster for everybody involved. It's not fair to the students. It's not fair to the supervisors. It's not fair to the clients. it's just across the board a really tough situation for everybody.
Agreed. Shifting focus a little bit, we at Sparks Behavioral Services, obviously we provide a lot of our services for adult populations, and part of, when we initially spoke and wanted to talk about, a lot of the supervisory experience is not necessarily geared specifically towards working with adult populations and diagnoses outside of autism and adults instead of children and outside of a clinical world and things like that. But BCBAs are working in group homes. We're working in adult foster care homes, things like that. Is there, I guess, what's my question here? Let's talk about some of those unique challenges. Do you think that we're doing a disservice by not providing a well-rounded supervisory experience by giving people more exposure to some of the contingencies that BCBAs in the adult world face?
Yeah, I think so, for a few reasons. I love talking about this topic because it's one of my favorite things to ramble about, so buckle in. We all know ACT loves a good metaphor, and one of their favorite ones is a magic wand. And if I could wave a magic wand over fieldwork supervision, I would love to see it model something like that of like medical clinical rotations, giving students the opportunity to experience field work with pediatric autism in a group home with a traumatic brain injury client, so they can see the different types of applications of the science, and they can also decide what area of focus they'd like to gain more experience in. One of the things that I do for my fieldwork students, the very first thing that I do is I have them go on ABAI's website, look at the special interest groups, and tell me which ones stand out to them. And the feedback I get about that assignment every time is, I didn't know we could do so many things. And it's very exciting, and it gives them the opportunity to dig a little deeper in areas that are fun and exciting to them. And then fieldwork turns less into, this is something that I have to do to finish my program, to, I didn't know I could look at it from this way. And it kind of helps accelerate that learning a little bit. The other piece that I think is important for services with adults is especially for our BCBAs that want to work in early intervention or want to work in pediatric autism care. Working in that setting, I've seen that a lot of BCBAs have a narrow focus. We're focused in on, can I make changes to support this client in being ready to go to school? Can I support changes in them being successful at home? But a lot of clinicians and really a lot of the general public don't realize what happens when a kid is no longer able to access services of direct ABA through their insurance, or what happens when they're 26 and they graduate from school. And that, I think, is a key component for people who want to work in the pediatric autism space, because that can help them plan really long term. And that is our goal as behavior analysts, to support our clients and give them systems to set up to be successful in the natural environment. And if we don't know what's coming, or we don't know what their natural environment looks like without us or without mom and dad, then how are we ever going to put that foundational work in to prepare them to be successful?
Yeah. The real, what do they call it? The services gap or something like that. Like once you're 18 or 21, depending on the state, where it just kind of becomes, I can't tell you how many 17-year-old clients I had back when I was working in clinical, and we were talking about, are you guys ready for 18 years old? And everyone was like, why do we need to be ready? What's going to change? Like, oh, everything's going to change. It's very different once we hit a certain age. Steve, go ahead.
Yeah, I was just kind of taking a devil's advocate approach, even though I 100% agree with you, because I really think behavior analysts or BCBA should be an expert in the science of behavior analysis. And then if you want supervision in a certain area to become an expert in that area, then you should move forward in that direction rather than it being autism centric. But we've seen several supervisees who are great behavior analysts and have a really good handle on the science struggle with the exam because it's so autism based, in terms of, all right, here's a scenario, how would you handle that? And in adult foster care home, you may handle it completely different, because now you have staff who are violating the consumer's rights if they're not implementing a plan versus a family that you're trying to find something that they can navigate more easily. And so do you think we're potentially doing a disservice by trying to have more experiences when that's not going to necessarily help them pass the exam versus, okay, this is going to make you a more rounded behavior analyst?
Yeah, I feel like that is something that has made fieldwork supervision more difficult as well. I think this model that we have has always been your academic work prepares you for the exam and your field work prepares you to practice. And I feel like with the increase in interest in these programs that there has been kind of a decrease in the quality of academic programs. So students who are in these programs are less prepared for the exam. And I found myself that I've seen a shift from when I first started supervising, how it's been so focused on application, to now I'm finding myself supporting a lot more in academic concepts or reviewing assignments or providing some extra learning opportunities to help break down these concepts that they should be getting support on and becoming fluent in at school. So I do think that, yes, our goal is to help our students pass the exam, but if we're focusing so much on passing the exam, then at the same time, this is unpopular opinion number 3, we're the only program or like professional career out here that doesn't have a limited license as a master's. Our limited license is a bachelor's degree. So if you decide to just go straight through to your master's program and do your field work in research, you can practice independently without supervision as a BCBA with no direct client experience. So I really think that we need to work on as a whole to kind of separate those back out and make sure that the academic programs that are out there are fully preparing our students for the exam, and that then we can shift that focus in supporting people in that applied setting like we're supposed to be doing during field work.
Yeah, I agree. I've been a proponent for years now. Whenever I'm at a conference and someone from the BCB is there, and I can speak up and say, this is great and all, but I think we need different expertise areas to be certified in, and really that, onus needs to be back on our science. And it all, for me, stems back to one supervisee I had that they came in with hundreds of hours of supervision. They already had their master's finished. And as we're going over something, I was noticing that the discussion was much more superficial than I was comfortable with, and said, all right, well, I know you know this, but, just give me the definition of reinforcement, and then we'll kind of build on it from there. And they said, oh, it's something someone likes. And my first thought is, oh, no. And so now, like, my supervision contracts, I'll say, listen, we're going to go back to the beginning, and then I'm going to dive as deep into the conceptual stuff as I can and theoretical stuff as I can, because partially I want you to be an expert in behavior analysis, and partially because that's what I find reinforcing as a supervisor, but we'll still teach you how to be a practitioner along the way, sort of thing.
Yeah. And a lot of those times I've had a few experiences there where people are coming in with a lot of hours and we start to have a conversation, and I notice the same things, like what you're done with classes, with the amount of hours that you have. I feel like this conversation should be going a little bit differently. And then you start to kind of like pull those holes a little bit to see if the thread unravels. And a lot of these students have no idea that they've had poor supervision experiences until they find a supervisor that can effectively supervise or knows how to supervise. And that is just awful for the students. I feel for them so much, because they are misled into thinking that they're getting an amazing experience until they find a new supervisor who does guide them a little bit better, or they're out in the field and they realize they can't do anything by themselves, or they only learned how to do something the way that that company likes to do things and not how they can operate independently in that activity.
Yeah, just have it out there in the ethos too. In that scenario, this person wanted me to sign off on them being ready to take the exam. I'm like, I can't do that. So I reached out to the BACB, and of course, they're not allowed to weigh in on that type of situation. But they referred me to the ethics hotline, which Dr. Bailey's lab at the time, and I don't know if he still is or not, was answering those questions. And his response was, and here's probably unpopular opinion number 57, but We are gatekeepers as BCBAs. You certainly should not sign off their hours if they are not ready to be a behavior analyst. And that opens another can of worms on potential litigation if they say, no, you just have to do this minimum. And so that's why I think those contracts are so important nowadays as well.
Yeah, absolutely. And then that's a whole nother level of responsibility. We have to weigh whether we're willing to risk our credential or our morals to sign off on this to avoid legal action, or if we're willing to sign off on these forms knowing that that person is not ready and putting them at risk and their future clients at risk. It puts people in a really, really tough spot.
What might somebody who maybe got some really good supervision, but in a very, every example, all the training was very clinically based, pediatric based. What challenges might, or have you seen if they move into like the group home space and they have only that one facet of exposure to applications of the field? Now they're in an adult foster care home. One example that I always think of is somebody suggesting we do DTT with a 60-year-old man who weighed like 300 pounds one time. And they're like, well, that's probably not going to be the most successful setup. There's probably other ways we can do this, because a lot of what we do ends up being more about shaping the environment and getting staff on board to provide the strategies as written, as opposed to what some might call like programming or something like that, or like skills-based teaching or things like that. Although that's certainly part of it, but it just looks very different. What challenges might somebody face moving into that space, walking in thinking I'm an expert in behavior, and then, oh, now I'm blindsided by this?
Yeah, I think that only working in pediatric autism services and then attempting to work in adult services is like jumping into an ice cold lake and then realizing that it was a mistake. I don't think working in adult services is a mistake by any means, but someone who has no experience in this world and no idea how to support adults with multiple diagnoses or adults that live in a home where they don't have one-on-one support, which is the case for almost every single adult that I've served. It's hard, and they've built up this confidence. They just passed their exam. This is usually like the peak level of confidence for BCBAs. And then all of a sudden they're hit with, not only do I not know what I'm doing, but then everyone else also can tell that I don't know what I'm doing. So I think if people are interested in adult services in any way, shape, or form, getting some insight into what those situations look like before they accept a job, whether it's a job shadow or even finding an independent supervisor that has experience there that can give them a window into what it looks like before they start or jump in, is going to be so helpful. I think the biggest challenges that once people are there, they run into are the requirements that are set by the local and state government, federal authorities, all of these different requirements that are being applied. We're working in a pediatric autism setting. Our person that we get consent from is a parent, and a lot of times if we're needing to manage difficult behaviors, we can use procedures that we are not allowed to use with adults because it's a violation of their rights. And I feel like that is the biggest difficulty that people find transitioning from that pediatric autism space to adult services, is the issue of recipient rights and what exactly counts as a rights violation and what you can do without having control over all of the variables.
Yeah, Steve and I were just meeting a little bit ago, actually, talking about a presentation just about those factors, because there are glaring rights violations and things that you'd look at on paper and say, oh, that's clearly a rights violation, taking personal property, things like that. But then there's other things that people don't think about, like, using reinforcers that, is somebody's personal property that they already own, or, withholding an activity to build up an MO or something like that. There's a lot of rules and regulation and legalities that come into it that make it less control on our end, but also more person-centered, and probably for great reason, seeing as how it's such a vulnerable population as it is, but very different though than the clinical world for sure.
Yeah, one of my examples I always give is that first time a BCBA is asked to put a restriction for a PRN in a plan, and like we have no business dealing with medications, and so I've seen people say, "Yep, give it this time, and this time," or when this is occurring. And I always tell our team, don't touch that with a 10-foot pole. You can put in the restrictions that there is a PRN that's prescribed by the doctor and should be used as written by the doctor. But that is not our job or our business to tell someone how and when to use a medication.
Yeah, absolutely. And that leads to like another great point of difficulties is adult services is a multidisciplinary team. We don't provide services in a vacuum when we support adults, whereas a pediatric autism center that provides ABA services is truly providing services in a vacuum. If they have speech or OT there, there's opportunities to collaborate. We can call and coordinate care with the school, but these treatment meetings and these treatment plans are so intertwined and intergrained with our OTs and our medical doctors and our speech pathologists and our nurses that BCBAs who don't know how to play nice with other professions also will have a very hard time in adult services.
I've also seen a disconnect with being the expert in the room versus just being the therapist as well. Oftentimes, by the time we're called in to work with someone, every medication under the sun's been tried. They've tried several different therapies, nothing's working, and then they expect you to come in and have all the answers. And in my time in autism setting, it was very much like we're going to let the parents kind of guide which direction we take things. Often it's very much we want to teach these skills that our assessments say need to be taught, but also we want everyone to be happy with their experience here. And when they come to us, it's like, yeah, you got to change behavior that they don't want to change, that society doesn't know what you're doing or why, but we don't care. You're just the expert here. And I can see that being a major culture shift for anybody that just walks into this world without having some sort of supervision.
Yeah, I think a lot of times too in adult services that BCBA might be the only behavioral clinician in the room. They might be the only one in the room that has any like extensive knowledge of behavior change protocols and procedures. So a new BCBA walking into a setting like that can feel very overwhelming because, like you said, Steve, they're seen as that expert and they're relying on them to fix something that they've all failed to support or fix. And not only that, you might not have any idea on how to support or how to change behavior within the confines and guidelines that are laid out in each specific case. It's tough.
Yeah, I think the first time I was asked by the team, okay, can we use OT and speech? How can we use it and that sort of thing? And I'm like, I don't know enough about their fields probably to answer that question. But what I can say is let's make sure that anything that's used is used proactively rather than reactively, because if they use some brushing in an OT type plan and that's reinforcing, you may directly reinforce that inappropriate behavior. And having the ability to on the fly kind of have those discussions with yourself and come up with some guidelines for someone is another thing that it's probably good the first few times to have someone there with you just ready to jump on that type of question.
Yeah. I have found, though, that working in the adult services world, it is a much more collaborative space. Even though I might be the only BCBA in the room, everyone is interested in working together and seeing how practices from their field can work together with practices from mine to come together and support that specific issue. So even though a lot of like what we're talking about does seem overwhelming and can be overwhelming for people that are new, there's also some really, really great positives to supporting adults as well.
Certainly, and we never want to push out those other professionals or try to make them seem like they shouldn't have a say, but you may be the expert there saying, hey, that's great, let's try it this way so we can all make it work together, that sort of thing.
Yeah. could be the missing puzzle piece that brings it all together.
Yeah, and in that light, given the behavior analytic knowledge that we bring to the table, without us there, the answer or the solution to this behavior might be a restriction, because there's nothing else that anyone can really think of that would be effective. But a restriction could be as effective at stopping a behavior or teaching a new behavior as a differential reinforcement program, something that you bring to the table that is truly a less restrictive attempt before jumping to more restrictions. So that's very cool. I love that you mentioned working with interdisciplinary teams. That's something that I had to really get used to, and it has been a rewarding experience, but like you said, can be maybe some growing pains just a little bit while you just try to figure each other out and just try to figure out everybody's kind of conceptual basis and where we're coming from. But yeah, I definitely like that. Changing gears a little bit, your website talks a lot about ACT. I'm very ACT adjacent. I like it, but I'm not going to pretend to be an expert or even claim to know everything what I'm talking about. But I'm just curious how the different conceptual basis of acceptance and commitment therapies informed supervision practice and how you use it in your day-to-day.
Yeah, I think that ACT has been very life-changing for me, because I am a proponent of, if I'm going to ask my clients to do something, I am going to be doing it myself, because that's a big expectation on someone. If I'm not willing to work through difficult emotions to bring my clinical practice or my life closer to what my values are, then how can I expect other people to do that? So it's kind of shifted my view on not only my clinical practice, but kind of my life as a whole. And it's been really awesome. Through supervision, I feel like ACT has been so helpful in giving our fieldwork students some autonomy in their practice and in their fieldwork journey, because I know a lot of supervision has our curriculums, they're guided according to the test content outline, and we're learning these practical technical skills. And then at the end, it's okay, well, I've been in pediatric autism this whole time. I'm just going to go take these skills that I've done and apply them to these clients. And we might not have focused on critical thinking or problem solving, or even what to do if you run into some roadblocks and how to use that to navigate. Whereas if we try to pull some of those in through supervision and make sure it's values-based and values-guided, that's a tool that we can give our supervisees that they can carry throughout their entire clinical practice, whether they choose to pass that on to their fieldwork students or not. At the end of the day, there's going to be a part of their brain, if they've spent 2,000 hours asking the question, does this decision bring me closer to being a compassionate supervisor? They're going to carry that on, whether they're meaning to or not. It's always going to be in the back of their head. I have also really found that ACT has worked so well in supporting my adult population as well, in the group homes and in the residential settings. I think this is one of the most person-centered applications of ABA, because the idea of ACT is we are helping people choose their best life or use their values to guide their behavior to make their most meaningful life. And we are not telling them which behaviors bring them closer or further from their values or from their perfect life. And we don't tell them what their values are. This is all decided by them. And we're just there to help guide them along the way. So it's been a really cool way to kind of incorporate ABA and giving some self-advocacy skills and some autonomy. I've seen my clients that are able to verbally process through some of these exercises really gain a lot of confidence and help with self-monitoring and self-regulation. And those are skills that give them access to so many more less restrictive environments like employment or community settings that they might not have been able to access before, or they had been asked to leave. I think it is just a really great way to make sure we're supporting our clients and making sure that they're staying at the center of our clinical practice without restricting their rights or without imposing our opinions about their life on them.
Yeah, very cool. You mentioned compassionate supervisors. Is that one of your big outcomes that you look for, is having folks that are not only knowledgeable, but, care and want to make a difference?
Yeah, I read the behavioral artistry article a few years ago where it talks about the 16 different personality traits that contribute to being a good direct care worker, being a good BCBA. And in this study, they looked at these, and there was 2 other human service groups and then a group of non-human service majors, which were like math and engineers. And BCBA scored 3rd for almost every single quality that makes a good behavioral artist, except warmth, which we scored the lowest. So that really changed my perspective. How are we supposed to support clients and families through some of the most difficult moments of their life, and even being in their home, which is very intimate and very vulnerable, if we're not able to be compassionate towards them or towards their journey or their situation?
Yeah, just the way you said that made me really think about it too, because we need to be compassionate, but we often find, consulting for the most severe aberrant behavior around, that if you really own that and take it home, then that work-life balance, it can really affect you in your personal life too. So are there good ways that you found to help people tiptoe that balance of being compassionate and caring and empathetic without being so empathetic that now I'm suffering at home after work, sort of thing?
Yeah. I think a big piece of that is making sure that people are able to practice self-compassion, which is a skill that not a lot of BCBAs are masters in. I think almost anyone in a human service field does that human service work because it makes them feel good to take care of others. But I would bet good money at least half of them are not very good at taking care of themselves. And that's something that we need to make sure that we're focusing on, and especially in supervision, setting up this resilience and making sure people can walk away from a very difficult situation where they might not have seen the outcome that they wanted to, and be able to accept that was the outcome and learn how to adjust their behavior as they move forward, but also acknowledge that they did the best they could in that situation. And that's okay. It's a hard skill for sure.
Yeah, I think I've often had to talk to our team and even warn new people coming on that you aren't going to be able to help every single person every time. And so if you have, let's say, a caseload of 30 individuals, because we're consulting, not working one-on-one individually with them, and you can do a really great job with 70%. You can do a good job with 20 more percent, and then there's that 10% that there's just barriers in place that you keep advocating for, but you may not be able to have the outcomes you want. And it's going to be better for society and for your consumers you work with to make sure you're spending your time with everyone and not just hitting your head against the wall trying to help that 10, 20% over and over and over again to the detriment of everybody else.
Yeah, absolutely. We can't save the world by ourselves, but together as a field, we can probably make a pretty big dent.
In your experiences, the different indicators of compassionate behavior, is that best taught by just modeling it in a supervisory experience? Is there actual exercises and practices that supervisees can put into place to learn that skill? I feel like not everybody is inherently compassionate necessarily, but it can certainly be shaped. What is your take on that?
I think the first thing that we need to do as supervisors is model compassion to our clients, to our students, to our supervisors, our own supervisors, across the board, and make sure that we are compassionate with ourselves when mistakes happen. We are all human, and we all have a lot of balls in the air at all times. So it's bound that something's going to fall. And I think how we react to that fall, or how we react to a supervisee's or trainee's mistake, really shapes how that supervisee will start reacting. That was one of the biggest things that changed how I handled things is when I became a supervisor of other clinicians. I started to notice that they were modeling my poor work habits and lack of work-life balance. And that was the moment where I was like, I can't do this anymore because it's not just me. This is trickling down. I can see it happening. And I need to make sure as a supervisor that my clinicians are feeling supported to do their best work. So I think modeling it as well, but ACT does have a lot of exercises that can focus on building self-compassion either through mindfulness work or some physical exercises and role play. And I do agree that those skills can be shaped over time. Even for someone who doesn't appear to be compassionate, we can at least work on some perspective taking skills and maybe some expected behaviors in those moments, even if that is not an initial reaction.
Your website mentions mentoring too, and we talked a lot about supervision, but I don't often see a lot of talk about mentoring. I know that, some people reach out for mentorship or, it's recommended sometimes like, hey, maybe you should seek a mentor in this. Do you think that that is not a missing piece, but something that's often overlooked as far as continued professional development goes?
Yeah, I think so. I think since we treat BCBAs as independent practitioners as soon as they pass their exam, sometimes seeking mentorship, even if it is in a best practice and is in our ethical code, sometimes shows weakness or that you can't handle what you have in front of you. But really what it shows is that you're committed enough to your clients to want to be better, or you're committed enough to want to learn more and expand your knowledge. And I would take a supervisor who is willing to seek out learning opportunities and admit that they need support rather than someone who believes that they know every single thing, because then the rest of the organization is expected to know every single thing. People don't reach out for help. This is when mistakes happen. This is when some serious issues can come up because people are more worried about hiding mistakes than seeking out and asking for help. And the mentorship has really come out of talking to my students who have graduated and passed the exam. The feedback that I get is, I loved being in supervision, and now I feel like I'm drowning without a life vest. So that really opened my eyes to, we prepare people as best as we can during supervision, but maybe the person who's overseeing them is an operations person that is making sure that we're meeting all the KPIs and not someone who can talk through a difficult case with them. So I think kind of as a community, we need to reframe the thinking about mentorship and seeing it more as a benefit and as something that would be really exciting and lucky to have, rather than you're seeking mentorship because the BACB said you had to, or you're seeking mentorship because your supervisor told you need to, or this case is way, 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 way out of your realm. Why can't we just have a mentor to just get a little bit better instead of seeking it to get one specific issue solved?
For sure. Go ahead.
First, I'd like to say, as a person that thinks they know everything, I feel personally attacked. And secondly, though, can you just describe maybe a little bit, is mentorship from your view just the same as supervision but ongoing after you have passed the exam, and just having someone there for to help you navigate these things, or is there a more clear difference between the two?
I think it's a little bit of both. My mentors in the field are a combination of, I reach out to them if I'm stuck, I reach out to them if I need to learn something, I reach out to them if I need resources or specific guidance. But sometimes I reach out to them because I've been thinking about them, or sometimes I've read an article and I want to know what thoughts they have on that specific article, or I see something new come out and I say, oh, I wonder what so-and-so has thought about this, or if they know about this, or if they know the person who wrote it, so I can ask them a little bit more about the process and the outcomes from their studies. So it really serves as support on both ends. It can be very intrinsically motivating to be a mentor because you get to help shape and grow future generations of BCBAs, but it also builds a network and a community. And we are as good as the entire community is. Our community is often judged on our worst practitioners, and I think that's true across every single field. So when we start to make these connections and we have multiple people that we can call when we're stuck or we're in trouble, or we have multiple people that we can get an opinion on before we decide to implement a specific procedure, that just makes us better as individuals and as a field.
I had one last question, unless anybody else wanted to chime in too. But just in general, what advice would you have for any supervisees or even BCBAs looking to make the transition into adult services or to start working in adult services?
I think the biggest piece is that a lot of times behavior support in adult services is not advertising for BCBAs. I hear that all the time. I would love to work with adults, but I see no BCBA jobs with adults. They are labeled differently. The person who was in my position before at the county was a licensed psychologist, and they weren't specifically looking for a BCBA. So if they are interested, reaching out to companies that provide those services or the local government to see if those positions are available and open for BCBAs. The second one is, after listening to us talk about all the really, really difficult things that comes with being a BCBA for adult populations, is to not take that to heart, because for every single difficult situation, I have probably had 4 or 5 really exciting and fun situations. Being an adult services BCBA allows you to be creative. It allows you to continue to learn. It allows you to collaborate with other professionals, and it allows you to support your local community if that's something that you're really interested in doing. I would suggest talking to BCBAs who are already in those positions rather than just jumping in to make sure it's the right thing for you, because a lot of times these adult populations are underserved, and jumping in and having a full caseload and then deciding that you can't handle it is difficult for the organizations that provide services and the individuals that you serve. So making sure that you can job shadow, or you can get a pretty good idea of what will happen by talking to other people in the field. And if you are new, highly suggest getting a mentor, or at least a group of peers that work in the same setting that you can collaborate with and work together to support your clients.
Perfect. I think that's all super sound advice. Liz, thanks so much for being here. Is there anywhere that we can go to learn more about Empowered?
Yeah, I have a website at empoweredbehaviorcollective.com, and I have an Instagram. My handle is Empowered Behavior Co. I'm not super active on it, but I'm hoping to start back up again soon. But yeah, those are my 2 spots.
Very cool.